A diagnosis of gallbladder cancer often comes suddenly. Here is what the surgery actually involves, step by step. The gallbladder sits just under the liver. When cancer starts in its lining, surgery becomes the main treatment option. Some people are diagnosed after symptoms like jaundice or belly pain. Others learn only after routine gallstone surgery. Surgery is considered when the cancer is confined to the gallbladder or nearby tissues, with no spread to distant organs. For the earliest tumors, removing just the gallbladder can be enough. Deeper cancers need a more extensive operation. The most common operation is radical cholecystectomy, removing the gallbladder, a wedge of nearby liver, and regional lymph nodes. Larger tumors may need a bigger liver resection or removal of part of the bile duct with careful reconstruction. Open surgery through one larger incision is standard for extended operations. Keyhole approaches are used in selected early cases. The hospital stay is usually 5 to 10 days. Pain control, walking early, and monitoring liver function all matter. At home, most people walk more each day, eat smaller balanced meals, and return to light activities within 4 to 6 weeks. After surgery, doctors often recommend a course of capecitabine chemotherapy for about 6 months to reduce recurrence risk. Like all major surgery, this carries risks: bleeding, infection, bile leaks, or blood clots. Experienced centers see fewer complications. Follow-up visits every 3 to 6 months, with scans and blood tests, help catch any recurrence early. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.